Good morning, everyone. Please check my audio and video if it is good to go. Welcome to the ophthalmology class. Good morning, everyone. Good morning, Aditya. So I was just seeing about half of you have not taken out the printout. So I had given you before so that you can annotate it along with me. So try to get it as soon as possible. And we are going to do ophthalmology in the most crisp and high manner, integrating all the 19 subjects. And I hope you will have a good time interaction with the ophthalmology. Audio video is okay. Thank you so much, guys. Good morning, RAC, Hemant, Shafna, Swati, Rohit, Narendra. Good morning, everyone. So we have the eyeball here, and those who have the printouts can open your page number 1. We have this great fellow there. And he is considered to be the father of the modern ophthalmology. Modern means the technical ophthalmology. When I'm talking about the test, I'm talking about the instruments. It is actually this great fellow who is all behind this. So write down his name. Good morning, Sam. Good morning. So actually we have tried to create this magical workbook which contains all the important images, and I want you to annotate it along with me so that after the class also you can see those images in your hand. Most of the times we get the image based questions in ophthalmology, so I wanted everybody to take out the printout of this. It's very good if you can take out the colored printout, but not to worry even if you have the black and white, because colored PDF of the images you will be having. So even if you are taking out the black and white, that can do. Okay, nothing like that, the colored printout. So are we good to go? Have you opened your page number 1, Albrecht von Graffy? Have you opened this? Now guys, little request from you people. You have to keep on telling me yes, or giving me the thumbs up so that I get to know that we are going on the right pace. Okay? So put down his name, Albrecht von Graffy. He is the father of the modern technical ophthalmology. Okay? Yes, ma'am, hai. Thank you, Priya and RAC. Now go to the next important image. You can see the next image in your workbook. If you do not have the printout, you can look at the screen also, no problem. Okay? Now see here, we have the eyeballs. We can all see this is the eyeball. Now where is this eyeball located? The part of eye when I am talking are two. One is the orbit and one is the eyeball. One is the orbit and one is the eyeball, and these eyeballs are actually placed inside the orbital cavities. So if you look at the shape of the orbital cavities, they are conical in shape like this. They are conical in shape, something like this. So conical, or we can call it as pyramidal, and they are holding the eyeball, something like this. They are conical or they are pyramidal, holding the eyeball, something like this. So I would say here that orbit is conical or it is pyramidal, and volume is 30 cc. The volume of the orbit is 30 cc. Shape is conical hai, and the volume is 30 cc. You can also look at the walls of the orbit. We have this one is the medial walls of the orbit. These are the medial walls, and you can also look at the lateral wall of the orbit. Medial and the lateral wall. Now can you see medial walls are parallel to each other and the lateral walls join this. This is your 90 degrees. So they are perpendicular to each other. Medial walls are parallel, lateral walls are perpendicular. So what will be this angle, guys? Who will give me the answer? What will be the angle between the medial and the lateral wall? We are looking at the different walls orientation For the orbit, medial walls are parallel to each other, lateral walls are perpendicular to each other. So what are we expecting? What is this angle? So KD has given the fastest finger first. This is 45 and 45 degree. This is 45 and 45. Are you getting this? Now once you have seen this orbit, you can see one is the apex part of the orbit and one will be, this is the base part of the orbit. So apex is lying towards me. Posterior side pe we have apex and in the front we have the base. So from the front, how does this base looks like? Look at the next one. How does this looks like? It is quadrangular in shape. You can see 4 walls in the base of the orbit. You can see the 4 walls in the base of the orbit. We have, this is the base of the orbit and it contains the 4 walls. Therefore, I can say it is quadrangular. So shape of the orbit was pyramidal, but the base of the orbit is quadrangular. Quadra means 4. We have got the 4 walls. We have superior and then we have inferior. Is it visible? I do not know. Then this one is medial, and this is your lateral. In this way, we have got 4 walls. Superior, inferior, medial, lateral. It is just like a room. We can call it as a roomy orbits. We have a roof, we have a floor and we have the 2 walls. ठीक है? Base of the orbit क्या है? It is quadrangular. Now how this eyeball is placed inside this orbit? See the next one. Beautiful. You can see this one is your base of the orbit and this is the eyeball. So this is how the eyeball is placed in the base of the orbit. How the eyeballs are placed inside the base of the orbit. This is your eyeball. And here like this in the base of the orbit, we have got the eyeball. We can do the different functions here: elevation, depression, adduction, abduction, and rotatory intorsion as well as the extorsion. So this we will study in the squint. We can have the different functions inside this. Okay, so we have seen the shape of orbit, we have seen the shape of the base of the orbit, and we also have seen how they are placed inside the orbit. Now, what is the shape of the eyeball, guys? Shape of the eyeball. So, if you focus on the shape of the eyeball, it is not a perfect sphere. We have extra curvature anteriorly. So, eyeball is something like this. We have a extra curvature anteriorly and this shape is called as the ablate spheroid shape. We have a extra curvature anteriorly. This shape is called as ablate spheroid shape. Now, why we are having this extra curvature? This is cornea. So, you will see that cornea will have the maximum power. That is why we have the extra curvature and this shape is called as ablate spheroid shape. Are you getting this? So, this shape is ablate spheroid shape. And then look at the instrument by which we can see the eye. Who will tell me the name of this? Name of this instrument? I think you all are post interns. You have done the internship posting. You must have done the 3rd year posting. And this is the first machine that you come across inside your of the OPD. What is this, guys? And it's, very difficult for the patient to hang on his chin over this. Chalo, quickly batao, what is this? Yeah, so we have Manikanta giving the right answer. Yes, Shafna, Gayatri, okay, yes. So this is the slit lamp. Yes. So everybody is pretty right. Swati hai, Bhavna, RAC, KD, Sahana. Yes, so this is the slit lamp. So slit lamp is the basic investigation by which you can see the different parts of the eyeball. Okay? Yes, Ritu. So on this basis, now open your notebooks. We will start writing the first one. We will start writing the first topic, that is your anatomy and the development. ठीक है, anatomy and the development of the eye. Now one more thing I wanted to tell you, see, in these 3 days of ophthalmology we are going to cover about 20 questions from the total of 200 questions. In your main exam you are going to have 200 questions. Out of those 200 questions, 20 good questions will be solved from these 3 days of ophthalmology. How we can divide this into 14 and 6. So 14 are from the main ophthalmology and 6 are from the systemic associations that we are going to cover along with the ophthalmology, the systemic associations of the all the diseases where we can have the ophtha related. So in this way you are going to talk about anatomy, physiology, biochemistry, path है, pharma, micro, PSM, ENT, surgery, medicine, pharma, psychiatry even, like, and the PSM. We'll be talking all the 19 subjects about this. And in due to this, you know, if you look at the PDF of the workbook that I have given, towards the last we have the ocular associations of all the systemic diseases. So that is the flow chart I have given to you, the table I have given it to you. And you know, very few people actually know that that is from Parsons. Now you all must be having Parsons, even if you have, but you must not be reading Parsons. But there are certain things which are must read from Parsons. So I have included those tables and those images of Parsons which you should do in the workbook only, so that at the last minute you don't have to open so many things. And Ophtha means just your workbook and your main notebook, and that's it. That will contain all images, even PYQs also. We will be doing topic wise PYQs in the classes. 5 to 6 years, which is important, up to 2017, all the PYQs also I am going to tell you. So I hope it's very, very clear. Now we start with the anatomy and the development. So I can say that the eyeball is, look at the font size, is it okay? Eyeball is the ablate spheroid in shape. The shape is ablate spheroid. It is ablate spheroid in shape, and also it is cystic in consistency. It is cystic in consistency. Guys, do you know what is a cyst? Cyst means a fluid-filled cavity. So eyeball contains the fluids, therefore it is cystic in consistency, and it is kept distended. It is kept distended by the intraocular pressure. We have intraocular fluids, therefore we have intraocular pressure inside it. Intraocular pressure inside it. This IOP. IOP normal is 11 to 21 mm of the mercury. This is the normal IOP. So there are certain things which are important for our exam. How to revise these things? We will keep on marking the most important things: ablate spheroid, cystic consistency, and normal IOP. Now what you have to do when you are doing your revision, then at that time you don't have to read the whole definition. Just see these 3 words and you are done. So in just 3 seconds you can do the work that was taking 10 seconds. Okay, because in the last just 3 to 4 hours and you can revise all of the ophthalmology. Okay. So this is the definition of the eyeball: ablate spheroid shape, cystic in consistency with a normal IOP. Now if I talk about the orbit, you have already seen the images of the orbit. So if you see what are the orientation of the different walls. So medial walls are parallel to each other. The medial walls of the eyeball are parallel to each other, while the lateral walls are perpendicular to each other. Now which one is the thinnest wall and which one is the thickest wall? Another important question. We have thinnest wall and the thickest wall. Thinnest is the medial wall and thickest is the lateral wall. We have the medial wall, which is thinnest, and we have the thickest wall, that is lateral wall. While most commonly to get the fracture, which wall is most commonly to get the fracture, and it's not the medial wall, it is actually the inferior wall or the floor. It is the inferior wall or the floor. This is called as, this fracture will be called as the blowout fracture. This fracture is called as the blowout fracture, and this is a very important PYQ. I must say this was asked in NEET PG 2018. Then it also came as an image based question in NEET PG 2019, and also recently in the FMGE examination 2023 also. Very important. This is the blowout fracture taking in the inferior wall. We can also call it as a floor, and so many times this question has been asked. Okay. So many times this question has been asked. Now next we will be talking about the coats of the eyeball. Coats, we can say, or the layers of the eyeball. We have got the 3 layers of the eyeball. 3 are the colors of the Indian flag, and 3 are the colors that we assign to the different coats of the eyeball depending upon their function. So first is the outer coat. Outer coat is the fibrous coat. It is the fibrous coat of the eyeball. This consists of the anterior 1/6 and the posterior 5/6. So whole of the eyeball can be divided into 6 parts. Anterior 1 part is called as a cornea. This is cornea, and the posterior 5 parts will be called as a sclera, while the junction of this cornea and the sclera junction will be called as the limbus. While the junction is called as limbus. Anterior 1/6 है, posterior 5/6, and the junction is called as the limbus. Now this I have written with the black color because black color stands for strength. Similarly, you can use the red color for the second coat. This is the middle coat. Middle coat is the vascular coat providing the blood supply. Vascular coat है, which is provided by the uveal tissue. So you will always remember that uveal tissue you had drawn with the red color because this provides the blood supply, this provides the nutrition, and this uveal tissue consists of the 3 parts. One is the iris, then one will be the ciliary body, and third will be the choroid. Third is the choroid. We have iris, ciliary body, and the choroid. Who will tell me the normal color of the iris? Ciliary body we will be talking about in glaucoma, responsible for aqueous formation. Choriocapillaries we will be talking in retina, the most vascular part of the eye. And then we have iris. Iris is the pigmented structure, and the color of the eye depends upon the color of the iris. So what do you think is the normal color of the iris? Please comment. Till then, I am telling you the third coat of the eyeball, and this I am writing with the electric blue color. This is the inner coat providing the neural function. So this is called as the nervous coat of the eyeball. This nervous is not anxiety, guys. Nervous is neural function. So neural functions of the eye are actually done by the retina along with the optic nerve. Retina along with the optic nerve. This is the 3 coats of the eyeball giving the total protection. Okay, we have fibrous coat, we have vascular coat, and we have nervous coat. So you have not answered the color of iris, guys. Color. What is the normal color of the iris that we are expecting? It is the, red color. Hemant, whose iris can you see red color, beta? Yes, it is dark brown. Dark brown color is the normal color of the iris. So वैसे तो we can have any color of the iris, like we can have blue color iris, है ना, blue eyes, Karishma Kapoor family. We can have green eyes, green iris if you look at your Hrithik Roshan, but normally it is dark brown in color. Yeah, so it is the dark brown color or the deep brown color, which is the normal color of the iris. Now we will draw the diagram of the eyeball. Now those who have the workbooks, you can see there I have already made the outer coat of the eyeball, and those who do not have can make it. Now how to make it, see, first of all you are going to draw this sphere, okay, and then we can draw the extra curvature like this. Okay, now after you have drawn the extra curvature, you can rub this inner area and you can get a perfect ablate spheroid shape. So this I have drawn there in the workbook also. If you do not have that, then you can draw it like this. Now if you do not have your eraser and pencil, then just draw the posterior 3/4 and then draw extra 1/4. That can also do. Okay. So this one will be the sclera. You can see this is the sclera and this is the cornea. While if you look at the junction, this is called as a limbus, black color hai. You can do the labeling over the printout or you can draw by yourself also, or you can draw. Now Atif is saying that it is black color. So Atif, always remember that iris is never black colored. The hole in the iris is black colored. Pupil is black colored. Iris is dark brown color. So once you have drawn this, now we can use the red color to draw the middle coat of the eyeball. Something like this is the iris. Then you can draw the ciliary body, and then going behind is the choroid. Something like this. This is the choroid. So here this is the choroid, you can see. Then we have this one. This is the ciliary body. And this will be the iris. This is the iris here. And behind this we will have lens. So here I am drawing the lens. You can see. Now this is very, very important that you know the different parts of the eyeball, because you know, once you do not know the different parts of the eye, then it becomes difficult for you to understand the pathology. Then you will have to cram. But now you know that where we have the different parts and we can assess it also. Okay. So this is the second coat, and then we are going to draw the third coat. So third coat ke liye I will use the blue color. How many layers do we have in retina, guys? How many layers do we have in retina? So I am going to draw a thick retina like this, and then one layer will continue to form the optic nerve. So this is the optic nerve, and I am coloring it yellow because optic nerve is myelinated. So this will be the retina, you can see. This is the retina, and this is the optic nerve. This is the optic nerve. How many layers in retina? Yes. So now Gaurav, Swati, Karisma, and Shahana, yes, KD also. It contains the 10 layers, and one layer continues to form the optic nerve. These are the 3 layers you can see. And the cavity which is made, this one is called as the vitreous cavity. This cavity is called as the vitreous cavity. This is the outer structure of the eye. Now, if you want to study the internal structure of the eye, for this you can divide the eyeball by an imaginary line. Now this is again very, very important that this is a imaginary line. Okay, this is not the real line. One thing more, we also have the ciliary zonules which are holding the lens in its position. These are called as the ciliary zonules. These are called as ciliary zonules which are responsible for holding the lens in its correct position. Okay. Now with the help of imaginary line, I am dividing the eyeball into 2 segments. So anterior to the lens will be the anterior segment, and posterior to the lens, this will be the posterior segment. So I can have 2 segments in the eye. One will be the anterior segment and one is the posterior segment. Anterior segment will be anterior to the lens and posterior segment will be posterior to the lens. Okay, this will be anterior to the lens. So all those structures which are lying anterior to the lens will form the anterior segment, and those structures which are lying posterior to the lens will form the posterior segment. And guys, this is the broadest classification in the ophthalmology. We first study the diseases of anterior segment, then we study the diseases of posterior segment. Even the super specializations of ophthalmology is like this. We have the specialist of anterior segment as well as the specialist of posterior segment. Now, what is the fluid of anterior segment? The fluid of anterior segment is aqueous humor, and aqua means water. That is why we are using a water blue color for this. Surya, you will have to wait. I will tell you that also. थोड़ा सा wait करो. We are reaching towards the chamber also. First study the segments. So you have the two segments है, anterior segment and the posterior segment. Anterior segment का fluid is the aqueous humor, while the posterior segment fluid is vitreous humor. So we have got this is the vitreous gel. Yeah, this is a good question. Lens किस में आता है? तो lens is included in the anterior segment only. Anterior segment means which is anterior to the lens, including the lens. Anterior segment will also include the lens. ठीक है? So one is the aqueous humor. This is called as the aqueous humor. This fluid is aqueous humor, while this fluid in the posterior segment is the vitreous humor. One is aqueous humor, one is vitreous humor. Now, the anterior segment can be divided into anterior chamber and the posterior chamber. Okay, Surya? Anterior segment can be further divided with the help of iris. So, anterior chamber will contain 0.25 ml of aqueous humor, while posterior chamber contains 0.06 ml. 0.06 ml. First, you draw the values. Again, I will write separately also. You can see we have aqueous humor, we have vitreous humor, the three coats of the eyeball, the shape, and the aqueous humor is having the watery consistency. Aqueous humor is watery while vitreous is gel-like. So this is the main difference between the consistency also, and vitreous humor is 4 ml. The quantity of vitreous humor is 4 ml. Aqueous humor you can divide into anterior chamber and the posterior chamber. Anterior chamber and posterior chamber, and anterior chamber में it is 0.25 ml, while posterior chamber में it is 0.06 ml. So these are the quantities: 4 ml, 0.25 and 0.06 ml. 0.06 ml. I will also share this diagram with you guys. So even afterwards, you can keep on looking over this. ये देखो. This is the total diagram of the eyeball. It's just coming. This is the diagram of the eyeball. Now you know what is the anterior segment, posterior segment, anterior chamber, posterior chamber. Now both the chambers are a part of anterior segment. Therefore, both of them will contain the aqueous humor only. And what is the depth of this anterior chamber? Anterior chamber ki depth is also important. The depth of anterior chamber is 2 to 3 mm. So normally it is 2 to 3 mm. You will see that it is deeper in the myopes because they have a larger eyeball. It will be shallow in the hypermetropes because they have a smaller eyeball. This is the depth of anterior chamber. And also if I talk about the vitreous humor, if I talk about the vitreous humor, it also contains the certain crystals. It contains the crystals of the hyaluronic acid. Hyaluronic acid crystals are present inside it, and these crystals are present in one more fluid that you have to tell me. This is a PYQ. Hyaluronic acid crystals are present in which fluid? One is the vitreous humor. Tell me the other one. And also this vitreous humor can be divided into three parts. We have primary vitreous, secondary vitreous and the tertiary vitreous. Vitreous humor can be divided into the three parts. Primary vitreous is the vitreous which is present before the birth, which is present before the time of the birth in the intrauterine life, is called as the primary vitreous, and it is vascular. It is vascular. How? Because it is supplied by the hyaloid artery. Because it is supplied by the hyaloid artery. So this one is vascular. Nobody told me which another fluid contains the hyaluronic acid, guys. Then the secondary and the tertiary vitreous होते हैं, they are present after the birth. They are present after the time of birth. So baby when takes birth will not have primary vitreous normally. Normally he will just have secondary and tertiary vitreous, जिसमें secondary vitreous will be the vitreous gel. The vitreous gel which is present at the time of birth is called as secondary vitreous, and tertiary vitreous are the ciliary zonules which are responsible for holding the lens in its proper position. These are called as the ciliary zonules. So basically ciliary zonules are also representing a type of vitreous only. Okay, they are also representing the vitreous only. So no answers, guys. Which another fluid? It is also the synovial fluid. Synovial fluid also contains, yes, now I am getting the answers, also contains the hyaluronic acid. Very good, Pranay, Tejas, Praveen. So this is another fluid here. Now this is the difference between primary and secondary vitreous. This is the difference between primary and secondary vitreous here. Now normally the primary vitreous is not present. So normally primary vitreous is not present after the time of the birth. And now we will have the secondary and the tertiary vitreous, but sometimes there can be abnormality. Sometimes primary vitreous persists. Sometimes primary vitreous persists after the birth. So if the primary vitreous is persisting after birth, then that condition is called as PHPV. Then this condition will be called as PHPV, that is persistent. This is persistent hyperplastic. Persistent hyperplastic primary vitreous. So as the name indicates, it is the persistence of the primary vitreous. This is called as persistent hyperplastic primary vitreous, which can give us the leukocoria. This is your first DD, leukocoria, that is whitish pupillary reflex. This is called as whitish pupillary reflex. So this is your first DD, very, very important. Now what you can do, guys, towards the last of your workbook pages or towards the last of your this notebook, keep on noting down these DDs, and whenever you get the cause of it, you can add there. So in this way, you are going to get the short notes of all the DDs in the last. Okay. So the first DD is the leukocoria, that is the whitish pupillary reflex. Please tell me if you have understood and if you have written, everyone. Please see if you have understood and you have written also. Then we will move towards the diameters of the eye. Diameters of the eye. So we were talking about the orbital cavity and we were having the eyeball inside it, something like this. So how many diameters are we expecting in the eye? Yes hai sabka? Are you writing? Speed is okay for you guys? Yes ma'am hai. So how many diameters are we expecting? 1, 2, 3 or 4? How many diameters are we expecting in this eye? So if you see, there are 3 diameters in the eye. One is this one. This one will be your antero-posterior diameter, like this. Eyeballs are placed antero-posteriorly. Yes, yes, Narendra, you are correct. We have got the 3 diameters. Then we have this vertical diameter. And then we also have like this, vertical as well as horizontal diameter. So mainly we have 3 diameters in the eye. One is anteroposterior, one is the vertical, and one is horizontal. Now which one will be largest, guys? Can you see which one is largest? Because our eyeballs are placed anteroposteriorly. So this will be the largest diameter. Now you are left with the vertical and horizontal. Now you can see the eyes are horizontally set. है ना? Eyes are horizontally set. That means horizontal will be more than vertical. So largest is antero-posterior, then is the horizontal, and the smallest is vertical. So you can remember this order in the form of V, H and A. You can remember this order in the form of V, H, A. ये क्या लिखा है रैक? V for vertical है सबसे पहले, vertical, then is the horizontal, and then is the antero-posterior, and then is the antero-posterior. Vertical will be the smallest. So we are starting with the smallest, then is horizontal, and then antero-posterior. This is largest. So in this way you can remember the smallest also, and you can remember the largest also. Now how to remember its diameter? So we have come up in 24 year from 23rd. So start from 23rd and keep on adding 0.5. You can get 23.5. Again add 0.5 and you get 24. This is all in mm. So it is 23, 23.5 and the 24 mm. And the 24, 23, 23.5 and 24. Now, if you see, we also have the volume of the eyeball, weight of the eyeball, as well as circumference, as well as the circumference of the eyeball, because eyeball was spherical. So, how much is volume, how much is weight, and how much is circumference? For this, again, remember just one thing, that is 6.5. So, if you start from 6.5, and at 0.5 you will get 7, and then again at 0.5 you will get 7.5, and you are going to get 7.5. Now one thing is very very important for your exam, and that is this. What is this, guys? Who will tell me what is this? CS क्या है? What is this CS? Let me see. One thing which is very important for your exam is this CS. What do you mean by this CS? Any idea? Can you guess? Can you guess this? Give me the answer, and then I am posting a poll for you. Corneal scar. और कुछ? Let me see. क्या imaginations है? Corneal scar बोला है, और क्या है? Corneal sensations. Shahana, oh, I love you for this. Yes, beta, common sense. So common sense is one thing that you always require, not the corneal scar. Do you require corneal scar for entrance examination or corneal sensation for entrance examination? It is the common sense. So what I wanted to say, that if you want to decide for the unit of this, ठीक है ना? So it is actually volume hai, to it will be in ml, because you know you cannot have 6.5 liters inside the eyeball. Then 7 will be grams. It cannot be the 7 kgs, and circumference will be in 7.5 centimeter. It cannot be 7.5 meter या फिर 7.5 kilometer. And that is why common sense, ये देखो, it's a rare sense, you people have proved it, है ना. Common sense is a rare sense. Central sinus, cavernous sinus, corneal sensations, and corneal scar. So always remember, please keep this common sense intact with you, because it is inversely proportional to studies. More you study, more you develop, fear. If I have not done this, then I won't be able to do it. If I have not read this, then I won't be able to do it. So you can do it. If you put some pressure on your neurons, and if you have read, then you can do it. ठीक है. So these are the different questions हैं. Smallest हो गया, largest हो गया, along with these 3 dimensions, along with these 3 things. So total 8 MCQs. Now, it is always difficult to remember the values. So इसके लिए what you can do, you can make the flashcards for this. Small flashcards you can make and stick to your table. So every time you are free and you can go look at it, you can keep on revising every day and you can remember this. And please remember to make your 20th notebook also. Okay. Please keep on making your 20th notebook, in which you will write all your mistakes as well as your volatiles, along with the volatiles also, plus your GT scores. Now, why I want to write the GT scores? This is for yourself, that you should be going high. You should be accelerating in your scores. Write the GT number. Number 1, you have to write GT number. 1, 2, 3 like this, the score, and along with this, whatever volatiles, whatever mistakes you did in that GT, write down the subject in which you did the maximum mistakes and the topic also. Here you have to write the subject also, and subject में topic precisely what was the problem. So when you go for the second GT, revise this so that you can keep on working on your weak points also. This is the ideal way of making the 20th notebook. If you have some problem in this, then you can DM me on the Telegram and we can discuss over this. Okay. Now I had given you one question, that eye of a neonate. Now all these diameters which I have talked about are actually the adult diameters. All these are the adult diameters. So I wanted to ask you, the neonate will have the same diameters or will have the different diameter? Will have the same or the different? You tell me. So I have got only 46 votes, out of which 60% are saying that it is same, and 41%, like 59 and 41% are saying it's different. Okay. Now we know that the normal visual acuity is 6/6. Okay. We all know that the normal visual acuity is 6/6. Now, do we have this visual acuity at birth? At the time of birth, do we have this normal visual acuity? No, we do not have this normal visual acuity. So that means obviously the refractive status is different at the time of birth. If the refractive status is different, then obviously the refractive surface, that is the size, is also different. So you have to remember that it is actually different. No means what? Are you getting this? We do not, acha, no matlab we do not have. Yes, no is this one. So we do not have the normal visual acuity at the time of birth. So how can I have the same size? So obviously it will be smaller at birth. If I talk about the eye at the time of birth, if I am talking of the eye at the time of birth, then obviously it is different. It is smaller. It is smaller. About 16.5 mm is the axial length. Yes, Gaurav, you are right. So we have smaller eyeball. Now, if we have smaller eyeball, we will have less refractive surface, therefore less power, and the rays will be focused more posteriorly. So every newborn will have the hypermetropia. Therefore, the newborns are hypermetropic by the +2 to +3 diopter. So every newborn is hypermetropic at the time of birth, +2 to +3 diopter. and slowly and gradually they will grow and they will become emetropic. So emetropia is attended by the age of 5 to 7 years. So actually, hypermetropia is good because it is acting as a stimulus for the growth of the eyeball, grow, get the normal size and become emetropic by the age of 5 to 7 years. So this is about the growth. Then we can also talk about the development of the reflexes. If I talk about the development of the reflexes, for the development of the binocular single vision, for the development of the binocular single vision, we have got the 3 reflexes here. One is the fixation reflex. Then number 2, we have the macular differentiation. And number 3 is the stereopsis. Number 3 is the stereopsis or the 3D perception. So there are different time of the development of these reflexes. Fixation reflex will come at 2 to 4 months, while macular differentiation will come between 4 to 6 months, and stereopsis, now this will take the maximum time. So this will start pretty early, that is 6 to 8 months, but it is completing very late, complete by the 5 to 7 years. But it is completing by 5 to 7 years. 2 to 4 months, 4 to 6 months, 6 to 8 months, and 5 to 7 years. Now, do you know what is macula, guys? Who knows what is macula? What is macula? Anybody? Which part of retina is the macula? Which part of the retina is the macula? Anybody? We have got the 2 kind of cells in the retina. One is the rods and one is the cones. So macula is which part of the retina? Central or peripheral? So Swati has given the right answer. It is the central retina. Macula is the central retina. So which cells will be present here? Because it is a central retina, so which cells will be present here? Rods or cones? Near the center of the retina hai, therefore it will contain cones. And what is the function of cones, guys? What is the function of cones? It is the color vision. So we have C for center, C for cones, and C for color vision. Yes, it contains the maximum cones. Now, can you see that the central retina, which contains the cones which are responsible for the color vision, is differentiating between 4 to 6 months of the life. So that means it is not present at birth. So that means newborns do not have color vision. And we always take so many, bright, colorful gifts for a newborn. So that is for our own joy. Newborn is not able to appreciate the colors. The first thing they learn is to fix. How do we fix? Now, look here. So I think everybody must have looking here. Why? Because you have that fixation reflex. So you are fixing on this object. But this fixation reflex is not present at the time of birth. And that is the reason why we always give the rotatory toys at the time of birth. Toy keeps on rotating. So wherever, baby is looking, they have a wandering kind of vision. They can always look at that toy. So that is also scientific. We give the rotatory toys at the time of birth. Now, once he has developed this fixation reflex, then comes the macular differentiation. He can appreciate the different colors, and then finally comes the stereopsis. That is the most, peculiar type of development, the stereopsis. That is the 3D vision. We all, enjoy looking at the movies by the 3D goggles. So stereopsis will start developing between 6 to 8 months, but finally it will develop by the age of 5 to 7 years. Now 5 to 7 years pe we are also developing emetropia. So total visual maturity, the emetropia, the normal size, as well as the development of the binocular single vision will come by the age of 5 to 7 years. And that is why if you see the nursery school and a nursery class, the what is the minimum age they are keeping? The minimum age criteria for a nursery class they are keeping is the 5 years, because before this, Ankita, can you ask for the notes afterwards? Don't distract the class. This is a request, okay? You can ask for the notes afterwards or during the break time. See, if it has distracted me, obviously students will get distracted. Okay? So, the minimum age criteria for admission in a nursery class is the 5 years. After the 5 years only, the baby will be eligible for sitting in the class, because he should be able to see the board, he should be able to see the teacher, he should be able to see his notebook, then his padosi's notebook also, then appreciation of the different colors, different shapes, which is taught in the main class. So all these things will be achieved by the age of 5 years. So out of your 20 topics, the first topic we have done, that is the anatomy of the eye. Please see if you have understood any question from this area, any of the thing that requires explanation, anything that you want to get a confirmation on. Anything you want to ask, you can ask. Then we can start with the embryology portion. The second is the development of the eye. Embryology portion. If anybody is having any question, you can ask. Otherwise, give me a thumbs up that the first topic is clear. Out of the 20 topics, this one is there. Yes, है सबका. Then we can start with the embryology, the development of the eye. Development of the eye starts at the 3 weeks period of the gestation. At 3 weeks period of gestation, we start the development of the eye, and it completes by the 9 to 10 weeks of the period of gestation. It is starting near the 3 weeks and it is completing by 9 to 10 weeks. POG is the period of gestation, and the gene responsible is the PAX6 gene. The gene responsible for the development of the eye is the PAX6 gene. Now the development takes place from the 4 structures. The development of the eye will take place from the 4 structures. Number 1 is the lens vesicle. Lens vesicle represents the surface ectoderm. The first is the surface ectoderm. Then number 2 is the optic vesicle. Number 2 is the optic vesicle. Optic vesicle represents the neuroectoderm. Neuroectoderm. First is the lens vesicle, second is the optic vesicle. Then number 3 is the mesoderm, and number 4 is the visceral mesenchyme. It is the visceral mesenchyme, which is coming from the neural crest. So there are 4 derivatives from which the eye will develop: surface ectoderm, neuroectoderm, mesoderm, and the neural crest. So no part of the eye will actually develop from endoderm. So if you have this in your question, straightforward you can rule out no part of the eye can develop from endoderm. So first is the derivatives of the surface ectoderm. The derivatives of the surface ectoderm you can easily remember by the mnemonic L3ENC square. You have a very simple mnemonic hai L3. So L for lens, L for lids, and L for the lacrimal apparatus. And L is also for the lacrimal apparatus. L for lens, L for lids, and L for lacrimal, and the L for the lacrimal apparatus. Then is E. E is for the epithelium. Epithelium of the cornea as well as conjunctiva. Cornea as well as conjunctiva will also develop from surface ectoderm. Who will tell me the type of epithelium present in cornea and conjunctiva? Meanwhile, we will discuss the derivatives of the neuroectoderm. What are the derivatives of the neuroectoderm? So, neuro means the nervous cord, and nervous cord means the retina along with the optic nerve. Retina along with the optic nerve. Tell me what is the type of epithelium in cornea and conjunctiva? Then neuroectoderm mein, apart from retina and the optic nerve, we also have secondary and the tertiary vitreous. The secondary and the tertiary vitreous, they were present after the time of birth. They are developing from neuroectoderm. Very correct. It is non-keratinized as stratified squamous epithelium. It is the non-keratinized stratified squamous epithelium. Then we also have the epithelium here of the iris and the ciliary body. Iris and ciliary body epithelium is coming from neuroectoderm along with the smooth muscles of the iris. Along with the smooth muscles of the iris. So this will give you the pharma association here. Do you know the names of the smooth muscles of the iris? Anyone? Smooth muscles? The names of the smooth muscles of the iris. You have done the pharma now. We have got two kind of muscles here. One is the constrictor pupillae. Constrictor pupillae muscle. And another is the dilator pupillae muscle. Constrictor pupillae muscle and the dilator pupillae muscle. Very correct, Pranay. So now what they are doing constriction of the pupil and they are doing the dilatation. So they will show the pupillary reactions. So they are showing pupillary reactions. And we know pupillary reactions are neurological reactions, and that is why they are coming from neuroectoderm. So basically the development always depends upon the function of the muscle. If the muscle is giving you motility, then it will come from mesoderm, but this muscle which is coming for the neural functions therefore will come from neuroectoderm. ठीक है ना? So the two coats are clear. Then coming towards the third coat. Third coat of the eyeball, that is the mesoderm. The third is the mesoderm. Mesoderm will give you the motility. So here we have primary vitreous. Primary vitreous was vascular, supplied by the hyaloid artery, and that is why this will develop from mesoderm. That is why will develop from mesoderm along with the extraocular muscles. How many extraocular muscles we have, guys? Your options are 4, 5, 6 and 7. How many extraocular muscles are there? Then we have the temporal sclera. Then we have the temporal part of the sclera. Then next is the vascular endothelium. Vascular endothelium, and then we have the choriocapillaries. We also have the choriocapillaries. So yes, everybody has given me the right answer. Today nobody is saying 6. Nobody is saying 6 today. What happened? So very correct. We have the 7 pair. Now here if you see there are 3 things. One is the sclera, one is the endothelium and one is the choroid. Some part of these structures will also develop from. Some part, yes, Surya, it is the LPS muscle that is making the difference and LPS is also included. So some part of these 3 things, that is the sclera, choroid and the endothelium, is also coming from the other ones, from the neural crest. That is why I have marked these structures. Some part of the sclera, choroid and the endothelium is also coming from the neural crest, and that is why I have marked this. If you see the number 4, this number 4 will be the neural crest. This will be the neural crest. Now this neural crest consists of 2 parts. One is the neural part and one will be your mesenchymal part. One is the neural part and one is the mesenchymal. Neural part say we will have the Schwann cells, one will be the Schwann cells and also one is your melanocytes and one will be the melanocytes. One is the Schwann cells, one is the melanocytes, while the mesenchymal part is giving rise to the orbit, the bony part of the eye, along with the trabecular meshwork. So we will be studying about this trabecular meshwork in the glaucoma that is responsible for 90% drainage of the aqueous humor along with the ciliary muscle. Now one more muscle which is not coming from mesoderm because ciliary muscle helps in accommodation. One was your extraocular muscle for the motility, one was your smooth muscle of the iris from the neuroectoderm and one is the ciliary muscle. And then is your sclera. Now whole of the sclera comes from the neural crest except the temporal part. This we have already studied. Temporal part was coming from mesoderm. That is why all except the temporal part. Then the next one is your corneal endothelium. The endothelium otherwise comes from the mesoderm, but only the corneal endothelium will come from the neural crest. And then we have the choroid stroma. The stroma of the choroid comes from neural crest, but choriocapillaries will come from mesoderm. So here is the sclera, here is the endothelium, and here is the choroid. So how can you answer these questions? If they are asking you about sclera, then you have to say about the neural crest. But if they are saying about the temporal sclera, go with the mesoderm. If they are talking about endothelium, go with the mesoderm. If they talk about corneal endothelium, go with the neural crest. If they talk about the stroma of the choroid, then it is the neural crest. And if they talk about the choriocapillaries, then it is the mesoderm. Now talking about the other stroma. So other stroma like talking about the stroma of cornea, stroma of the iris, stroma of the ciliary body. All this stroma will also come from here. Scleral and as well as the stroma of choroid. So all the stroma is also coming from neural crest. This is all about the development of the eye. All about the development of the eye. So any question related to anatomy of the eye as well as any question related to the development of the eye can be solved from here. Please see if you have any doubt related to this, you can ask. Any doubt related to this, you can ask. I will share. Here you can see. Which one was our batch? This one. You can look at the quiz question. These are the PYQ questions. Try to answer these. If you have any doubt in any of these questions, you can ask me. If you have any other doubt, then also you can ask. And meanwhile, you can answer these questions. These are the PYQ questions related to the topics that we have done till now. Then we are going to take the next important topic, which is again a must for your entrance examination, related to the visual acuity. So after this, we are going to take the topic of the visual acuity. You can just answer the options instead of writing this. That way also you can do. So you can open this one in your printouts, visual acuity. Next chapter hai visual acuity. And you can also see this visual acuity chart, the most popular chart that we are using for taking the visual acuity. This is called as Snellen's chart. The most commonly used chart is the Snellen's chart. Most commonly used chart is the Snellen's chart. You can see. So in this Snellen's chart, the distance at which we are asking the patient to stand, this distance will be the 6 meter. The distance at which we are asking the patient to stand is the 6 meters. Okay, or it is equal to 20 feet. 6 meter or 20 feet. Therefore, the normal visual acuity will be 6 by 6 or it is 20 by 20. So, India mein we take this distance in meters. Therefore, it is 6 meters, and in US we take this distance in feet, 20 feet. So, either it is 6 meters or 20 feet. Therefore, the normal visual acuity is 6 by 6 or 20 by 20. Okay, are you getting this? So, when the patient is standing at a distance of the 6 meters and he is reading this topmost letter, then it is 6 by 60. Then I would say that the visual acuity is 6 by 60. Next line, if he is reading, then it is 6 by 36. Then next it is 6 by 24. Then next is the 6 by 18. Then 6 by 12. 6 by 9, and finally it is 6 by 6. This is how. Now 20 by 20 may we have an extra line of 20 by 25 that we do not have in the 6 by 6 chart. So whenever my patient is able to read from topmost letter to the bottommost, I would say it is normal visual acuity from 6 by 60 to 6 by 6. From 6 by 60 to 6 by 6. Now, if you see in all these, the numerator is 6. That means the patient is standing at a distance of 6 meters. So, numerator is representing the distance at which the patient is standing. And then if you look at denominators, they are changing. 60, 36, 24, 18, 12, 9 and 6. They are changing. So these denominators that we are having are showing the scale. What I mean to say, that if the visual acuity is 6 by 60, 6 by 60, then this 6 is actually the distance. This is the distance of the patient from the chart. The distance of the patient from the chart is actually the 6 meters. And 60 means the distance from which normal person can read this letter. Distance from which normal person can read this letter. तो बहुत simple है. What a normal person can read from 60 meters. This person is reading from 6 meters. That is why we will say that the visual acuity is 6 by 60. Similarly, if I say 6 by 36, So what a normal person can read from 36 meters, this person is reading from 6 meters. Then it is 6 by 24. So what a normal person can read from 24 meters, this person is reading from 6 meters. 6 by 18. What a normal person can read from 18 meters, this person is reading from 6 meters. Then is the 6 by 12. What a normal person can read from 12 meters, this person is reading from 6 meters. 6 by 9. What a normal person can read from 9 meters, this person is reading from 6 meters. And finally is 6 by 6. What a normal person can read from 6 meters, this person is also reading from 6 meters, and therefore we have normal visual acuity. This is the meaning of the visual acuity, and how we are getting these scales of 36, 24, 18, 12, 9 or 6 along with this 60. Why we are getting these scales? This is actually due to the minimum angle of resolution. Minimum angle of the resolution. This is based on the minimum angle of resolution. So our visual acuity is the resolvable visual acuity. We have the minimum angle of resolution. What does this mean? Suppose I show you this letter E. Suppose I show you this letter E. So you are able to read this letter if you can see these limbs separately. If you are not able to resolve these limbs separately, then you will not be able to see this letter. So the minimum angle which is present between the limbs of these letters is called as minimum angle of resolution. Now each letter of the Snellen's chart is fitted inside a square. Each letter of the Snellen's chart is fitted inside a square which is 5 times the limb breadth. So if I make a letter here inside a square, I am making a square here 1, 2, 3, 4 and 5, and 1, 2, 3, 4 and 5 here, something like this and something like this. Inside this square we have the letter E like this, and each limb is 1/5 because the letter, the whole of the square is 5 times the limb breadth. So one limb will be like this. Then we have another one. Then we have the another one. And finally it is like this. This is the total square along with this letter E. So you can see it is 5 times 1, 2, 3, 4 and 5. So square is 5 times the limb breadth. Now the minimum angle that it should make at the center of the lens so that we can resolve this letter is this one at the nodal point of the lens. Nodal point is the center of the lens. This is the nodal point, or it is called as the center of the lens, nodal point of the center of the lens, and this angle is the 5 minutes of the arc. It is 5 minutes of the arc. This is called as minimum angle of resolution. Okay? And this distance is the 6 meters. 6 meters. So usually because patient is standing at 6 meters, nodal point, whenever I am saying, I will always take the distance to be 6 meters. Now if a patient is going closer to the letter like this, okay, if you are decreasing the distance, then you will have larger and larger angle of resolution. So as we go closer, you can say as we go closer to the letter. As we go closer to the letter, the angle increases. Angle size will increase. Now the minimum angle which a letter should make so that this letter is visible is 5 minutes of the arc. And all the letters of the Snellen's chart are visible. That means all the letters will make this 5 minutes of the arc. All letters will make 5 minutes, but they are visible from the different distances. They are visible from the different distances. Why? Because the size of the letter is different. You can see the topmost letter here is largest and then smaller, then smaller, then smaller. So the largest letter will make this angle at the largest distance, then smaller distance, then smaller distance. So it is from 60, then it is coming to 36, then 24, then 18, then 12, then 9, and finally 6. So now I can say that each letter of the Snellen's chart, each letter of the Snellen's chart makes the minimum angle of resolution, which is equal to 5 minutes of the arc, but at the respective distances. Each letter will make 5 minutes of the arc, but at the respective distances. So that means if I am talking about 6 by 60, so this will make 5 minutes at the 60 meters. If I am talking about 6 by 60, then this will make 5 minutes at the 60 meters. And if I am talking about the 6 by 36, then this will make 5 minutes at the 36 meters. Then 6 by 24 hai, this will make 5 minutes at the 24 meters, and so on. It is something like this. So each letter is making the minimum angle of resolution, but at the respective distance. So if I am talking about the respective distance, then they will all make 5 minutes of the arc. 5 minutes of the arc. Now what do you mean by this minutes of the arc? If you compare it with a clock, ठीक है ना, clock में we have this 12 o'clock है, 3 o'clock, 6 o'clock, and then we have 9 o'clock like this. So this total makes 1 degree. This total makes 1 degree. So 1 degree basically, 1 degree is equal to 60 minutes of the arc. This makes the 60 minutes of the arc. So 5 minutes of the arc, when it is something like this is your 5 minutes. When it is 1, then it is 2, and this is 3. So this is actually 5 minutes. So when whole of the clock moves, that is 1 degree. Total 60 minutes. So basically, minutes of arc is a smaller degree of the this angle. Okay. So on this basis, they can give you one question to solve. You can see this is AIMS PYQ 2017 May. They had asked this question. What is the angle which is subtended by the topmost letter of the Snellen's chart at the nodal point of the eye? Whenever you say nodal point, it is 6 meters. And the topmost letter is 6 by 60. So 6 by 60, how much angle? How much angle? This will make 6 by 60 letter at a distance of 6 meter. Now first of all, you have to write what you already know. This will make 5 minutes at the 60 meters. है ना? Each letter will make 5 minutes of the arc at the respective distance. You have to find what is the angle at the 6 meters, because nodal point is 6 meters. So how can we do it? Do you remember I told you that whenever you are going closer to the letter, angle will increase. So here we are going closer. Here we are going closer by how many times? So this angle will increase because we are going closer by 10 times. 60 upon 6, we are going closer by 10 times. Therefore, angle will increase by the 10 times. So angle will increase by 10 times. So angle will become 5 into 10 equal to 50 minutes. Therefore, it will become 50 minutes. Please see if you have understood this. Give me a thumbs up if you have understood this. If you have not understood, then also tell me. How to solve this question, anyone? Have you understood? And if you have understood, can you tell me the answer for 6 by 36? What is the angle at 6 meters? What is the angle subtended by 6 by 36? Yes, ma'am, hai Revati. What about others? Because this is actually a well predicted question for your NEET PG 2024 because this was asked in 2017. Uske baad this was asked in INSET November 2022. They have not asked this in NEET PG from the last 5 years. So it's a very, very important question for this. Yes. So how many times we are coming closer here? Here you have to see 36 upon 6. So we are coming closer by 6 times. Therefore, 5 into 6 is equal to 30 minutes. So you don't require the paper and pen also. Just divide by 6 and multiply by 5. Basic distance is 6. Divide by 6 and basic angle is 5. Multiply by 5. Then tell me the answer for 6 by 24. Yes, because each letter makes an angle of 5 minutes of the arc at the respective distances. So each letter will make 5 minutes at respective distances. So that means this will make 5 minutes at the 24 meter. Please see Dr. Garg. And they are asking how much angle at 6 meters. So how much closer we are going? We are going closer by the 4 times. And therefore angle will increase by 4 times, 20 minutes. Therefore angle will increase by 4 times, 20 minutes. If you have understood, then tell me for 6 by 18. 6 by 18. सिक्स बाय 18 का क्या होगा? वी आर गोइंग क्लोजर बाय 3 times 18 by 6 and therefore angle will be 5 into 3, 15 minutes. Therefore angle will be 5 into 3, 15 minutes. 6 by 12. 6 by 12 का क्या होगा? We are going closer by 2 times. So 5 into 2, 10 minutes. Therefore 5 into 2, 10 minutes. Gaurav, have you understood now? Gaurav? And 6 by 6 में it is only 1. So 5 into 1 is equal to 5 minutes. This was asked in the INSET November 2022. INSET November 2022. So from 6 by 60 to 6 by 6, I have told you every concept. Please see. If you have not understood even now, please tell me. If you have not understood, then tell me. Gaurav, have you understood how to solve this question? From 6 by 60 to 6 by 6, yes or no? Then come to the next one. Next page pe you can see this is the E chart. This is used for the illiterates. For the illiterates, we can use this chart. For the illiterates, we can use this chart. So this is called as E chart, or we can also use the Landolt C chart. E chart or the Landolt C chart we can use. So whenever my patient is not able to use the simple ABCD, then in that case I can use this. Just a second. Then in that case, I can use this E chart or C chart So I can ask the patient in which direction the mouth of E is opening, like this or like this, or it can be like this or it can be like this, up, down, right or left. And in this way also I can take the visual acuity. Similarly, C chart is also there. C chart, maybe I can ask you in which direction the mouth of C is opening. So this is again from 6 by 60 to 6 by 6. The scale remains the same. The scale remains the same from 6 by 60 to 6 by 6. Only the letters are changing. Even we can use this in the small children also. The small children who are not able to follow your ABCD, we can use this chart. This is called as E chart or the C chart. E chart or the C chart. And then another one is this one. This is called as the simple picture chart. This is called as the simple picture chart. So this simple picture chart is used for the toddlers 2 to 5 years of age. Very, very small children who are just 2 to 5 years of age, who cannot cooperate even in E and C chart. Then I can show them the simple pictures from day to day life. जैसे कि we have house है, cats है, pets है, simple shapes है, and scale is again from same 6 by 60, 6 by 36, 6 by 24, 6 by 18, 6 by 12, 6 by 9 and 6 by 6. So scale will remain the same. Instead of the letters, I can show you like this. This is good, Gaurav. Thank you for giving the answer. Simple picture chart है for the toddlers between 2 to 5 years of age. Then we have another thing. This is your optokinetic nystagmus drum for children who are 1 to 2 years of age. For children who are between 1 to 2 years of age, इसके लिए we can use the optokinetic. In the workbook, image is there. Here I do not have image. I have forwarded it over the group. Optokinetic nystagmus drum. Optokinetic nystagmus drum है. This is used for the children between 1 to 2 years. So you have this drum something like this, okay, and you have got these alternate patterns of black and white. So we are actually rotating this black and white drum in front of the baby, and if it is able to induce the nystagmus in the baby's eye, that means the visual acuity is there. This is called as optokinetic nystagmus drum. This is called as optokinetic nystagmus drum. And finally, if the child will be less than 1 year of age, very, very small है, less than 1 year है, then we can take by ERG, electroretinography. Electroretinography. This is the total way of taking the visual acuity in the different age groups, literate, illiterate, everything. The concept of minimum angle of resolution also. So this completes your 3 topics. Out of the 20 topics, we have done with the anatomy, we have done with the development and the visual acuity. So out of 20 topics, we have done the 3 topics. Any question related to this can be solved from this information along with the images. So any doubts from this section are welcome. You can start posting your questions. I can answer them. You can ask the questions from this part. If you have any doubt from this, any doubt in any of these things, then we can discuss this, because then we are going to start with the lens. So I think that we can solve the questions and doubts related to this, and then only we can start with the new topic. Anybody having any of the doubt in any of the topics? Minutes to degrees, yes. So beta, it was the 60 minutes of the arc. This was equal to 1 degree. Okay? So, when it is making 1 complete rotation in the clock, that is 1 degree. 1 degree kitna, and then total mein how many minutes we have? That is 1 minute. है ना. So this is 60 minutes of the arc is equal to 1 degree. So when I say 5 minutes, है ना, 5 minutes, so this will be equal to 1 upon 60 into 5. That will be equal to 1 upon 12th of a degree. This is the conversion between the degree and the minutes of the arc. Any other question? Any other question? Alright, so here we take a break. We have done with the anatomy development and the visual acuity. After the break, we will start with the lens. Till the time, please look at the things, and still if you have any doubt, then we can post it and we can solve it. So see you after the break, guys.